All right, good morning, everyone. My name is Brooke Phillips. I'm the marketing manager with Shield Healthcare, and I'd like to welcome you to today's webinar on the structural burden of caregiving. Before we begin, just a few housekeeping items. Attendees will be in listen-only mode. If you have a question, please type it into the question box on the right-hand side of your screen. A PDF of the presentation slides is also available as a handout, and you can also download that from the webinar on the right-hand side of your screen as well. If you registered as a nurse and would like to receive CE credit, look for an email from Capital Nursing Education containing your CE certificate within the next 2 to 3 weeks, no later than the next 2 to 3 weeks. And if you miss any portion of this presentation or would like to share it with a colleague, the webinar is being recorded and it will be available on shieldhealthcare.com/community by the end of this week. Now I'm delighted to introduce Kelly Sparks, RN, BSN, CWOCN, CFCN as our presenter today from Capital Nursing Education. Kelly Sparks has been a CWOCN for over 25 years and a nurse for over 30. She's worked in wound, ostomy, and continence care for most of her career. She's been on the board of directors of the Pacific Coast region several times in the past, as well as being on multiple projects for the WOCN certification board. She's active with the local Sacramento WOC nurse group where she serves as secretary. Kelly has recently retired from Dignity Health, but continues with her private practice. She's been a speaker for many different conferences and classes. She enjoys speaking for Shield webinars and working with Capital Nursing Education to help promote education necessary for the care of patients. At this time, I'd like to pass the presentation over to Kelly. Kelly, it's all yours.
Thank you, Brooke. Good morning, everybody. This is going to be a very fun and exciting webinar here, I think, today. The structural burden of caregiving is what we're going to start with here, and it's not moving. There we go. So the objectives. We're going to look at these objectives from different points of view. First, from the caregiver's point of view, we're going to explore ways to navigate the healthcare system and learn the laws pertaining to the elderly, learn about the time and effort needed to manage care, not just the insurance part, but caring for somebody, and investigate ways of negotiating services. So from the nurse's point of view, you want to learn how to guide your caregivers to advocate for their loved ones and understand the differences in the coverages of the insurances and recognize when further help is needed. So looking at, first of all, what is a healthcare system? I mean, they're all over the place. There's different ones for a lot of different areas, but they have a vital and continuing responsibility for people throughout the lifespan. According to the World Health Organization, each healthcare system should be directed to achieve 3 overall goals, and you can see them here. They are the good health, for responsiveness to the expectations of the population, and fairness in terms of financial contribution. So there's 4 different vital functions that they need to include, and one is service provision, one is resource generation, financing, and stewardship. So in today's complex world, it's really kind of difficult to say what is in a healthcare system, what it consists of, where it begins, and where it ends. So there's different sectors that need to be closely coordinated. So we're going to look at this part of it. As you can see, there's different levels, okay? Self-care, primary professional care, general specialist, and subspecialist. The self-care, that's going to be what we do at home. That's going to be helping to take care of each other, self-diagnosis, self-medication, anything that you're doing at home to prevent disease or to maintain your health. That would be your self-care. The second level is your primary care physician, primary professional care, and that's going to include the entire team, your doctors, your nurses. You know, it could include even your birth attendant or home care specialist or whatever. And then the next one that comes up is the specialist care. That's going to be your people that your primary care professional, who is your gatekeeper, he's the one that's going to refer you to the specialist care. That's going to be people like a surgeon or an internal medicine specialist or gynecologist, psychiatrist, etc. So that's the generalized specialist care. But then we might need some tertiary care, such as your subspecialists, and that's going to be people like your neurosurgeon, so real specialists. And as we climb this pyramid, we get up to where the nephrologists, the cardiologists, the plastic surgeons, the people that the other ones underneath can't take care of. So systems are all different, but is it that simple? No, it isn't. There are other things that you have to look at, like your home care services, inpatient care, outpatient care, memory care, assisted living, there's skilled nursing, there's rehab. All of these things, including the durable medical equipment, all of these things are things that make it so that you really have to know what you need and how to get it. So, this brings me to a thing about laws here. I really have to explain about some of the laws with elderly people, because as we take care of people, it's important to understand what the laws are. So let's go a little bit through that. Elder abuse. Well, physical abuse is anything that causes them harm, or pain or impairment, anything that causes them harm. Emotional, psychological abuse, of course, is anything that causes them distress, anguish. Common forms are like, might include verbal assaults or yelling at them or humiliating the elderly, threats or insults, harassment, or even treating them like children. That is a very emotional, psychological, abusive thing to do. So, and then sexual abuse, we know, is just non-consensual sexual acts with an elderly person. Neglect is interesting because it refers to the failure to fulfill his or her duty to provide care needed by the elderly person. So there is passive and active neglect, meaning the caregiver either intentionally withholds care, which would be active, or maybe they're too stressed, or they have a lack of resources and they're withholding care that way. That's a passive neglect. So any failure to provide a dependent senior with life necessities is going to be your neglect. Now, self-neglect is way different. That's the only time that there is not a perpetrator. Typically, self-neglect occurs when an elderly person who has been determined to be mentally competent, when that person refuses himself or herself to have adequate hygiene, food, water, medication, and care from other people, they know what they're doing. That is self-neglect, and it's identified as a form of abuse only for the purposes of referring such cases to the Adult Protective Services. So if you see somebody that is totally mentally capable of taking care of themselves but refuses to do so, that is an APS referral. Financial abuse, that would be like if you use their checkbook, you sign their name, steal their credit cards. If they give you money to go buy something and you go buy something else, that is a form of financial abuse. If you steal something from their house or anything like that, that's a material abuse too, or financial abuse. And, one of the things that happens to these elderly people is, most of them own their homes outright. And they'll get phone calls from people, and there's con artists out there that do this all the time. They get tricked into signing their house over with the deed to their house. They get tricked to signing that in exchange for future payoff. It never happens. So that's one of the things that really happens to these people, and it's so sad. We all have to watch out for that. Abandonment can happen when the person that is assumed to has assumed the responsibility of taking care of this person. When they desert them, I mean, you can leave them at a grocery store, at a hospital, or just never pick them up from the skilled nursing, whatever. Perhaps the abandoning person feels overburdened and believes that they can't, care for that person. That could be one of the reasons for abandonment, which is an elder abuse issue. different abandonment laws for different places. I'm not going to go into those, in depth, but it is purposeful and permanent desertion of an elderly person. And there's different laws in different states, so you'll have to look into that for your own state. Would be good. So now we're going to start with this scenario. So first of all, you are getting a big surprise all of a sudden out of nowhere. You're going to be a caregiver, and you're going to have to figure out how to navigate through this. So what happens is, your sister and her husband live in a different state. They've been caring for your mother, and all of a sudden they text you and say, I'm bringing mom to you. And it's going to be today. So this is totally unexpected. Your mother arrives and she doesn't even recognize you. You just saw her last month, but she doesn't recognize you at all. Obviously, she's got some dementia going on. She has a bag of clothes, literally, and 1 week of medications in her purse. And also she walks with a walker that is kind of broken and kind of shabby. And thank goodness she's just retired, because you can do this. Otherwise, you'd really have a hard time. So what are you going to do? There's assistance. Oh, my goodness, your husband is not willing or available to help. Part of the time he will, but some of the time he won't. Your children aren't available, and you have 3 steps into your home, just like this one. What are you going to do? Mom can't even walk up those steps very well. One of the things, the first thing is this. I'm telling you, it's a great site, ElderCare Locator. You put in your zip code, and it pulls up a complete database of all types of outreach materials and contact information. It's wonderful. It has an aging network for the elderly care locator, long-term planning, all kinds of publications. The next one there, National Respite Network and Resource Center, is really good. It has a 9 steps to respite care for your family dealing with persons with dementia. Really good resource. Look these up. They're in the references in the back. Local Alzheimer's Association chapters is super helpful. You can sign up for their classes. You can go to their support groups online, or you can do support groups in person. You can also, don't forget, you can also make donations, and that is a very good place to make some donations. It's a good site. You need to go there and look at it if you know anybody that needs any help with dementia. So here's your scenario. Your mother's current health. She's 92 years old. She's diabetic, type 2, hypertension, macular degeneration. She can barely see. She's got osteoporosis, left hip pain, dementia, of course, and she's hard of hearing, and her hearing aids are really old and they don't work very well. She is incontinent of urine and stool, chronic loose stools, you'll figure that out later, and then incontinence-associated dermatitis with frequent UTIs, onychomycosis to 10 toenails. Their toenails are really long, psoriasis, both arms, peripheral neuropathy, and she's walker dependent, but she can use a cane sometimes. So you can see you've got a lot of things to deal with here. So her surgical history, she had a right hip replacement when she was 80. She did real well with it, but now she's got left hip pain. She had a total abdominal hysterectomy and bilateral salpingoophorectomy at age 60. Left knee replacement at 65. She had a hemorrhoidectomy at age 80, and she had colon cancer when she was 75, which is why you find out later she has these chronic loose stools. She had the left side of her colon resected. She has multiple skin cancers of unknown type, so you're going to need to look into that as well. She's a mess. Your brother-in-law is telling you of her behavioral challenges. It's interesting, the behavioral challenges that come with dementia. You can see she's been argumentative. She gets mean sometimes, but then she has these times where she's really sweet and nice. Refuses to shower regularly, hates the water, and you're lucky, they've been lucky to get once a week in the shower. Everything she does has to be her idea. She refuses to purchase a new walker because she's really tight with money. Doesn't want physical therapy, doesn't want exercises. Basically, anything that's good for her, she doesn't want. She refuses to have her toenails cut, even though you know how to do that. And, you know, as you've heard in other webinars, when the elderly patients, when they start to lose their taste buds, the last thing to go is the sweet. And that's what she wants, is nothing but sweet. She doesn't even want you to comb her hair. So you've got all of these things to deal with her, and you just need to know where to start. Well, you're going to check her vital signs first and check her skin, because that's what you do in your head. And you're going to look at her medications and make sure that she has everything up to date and the dosages, etc. You're going to have to look into her insurance, and you're going to have to find a PCP. You need to make some appointments, and if necessary to get her medications, you're going to have to go to an urgent care. But one thing you really, really need to know is, with somebody with dementia, you need to talk very gently, be very gentle with them, talk to them like an adult, and you really can't ask them very many questions, because when you ask a question and they don't quite understand what they're supposed to hear or say, they get very frustrated sometimes, and then that comes out as anger defensive mechanism. So you got to be real careful with that. It's pretty difficult to get them to understand that you're trying to care for them and not trying to make them do things that they don't need to do. So you have a room you're going to put her in. You need to get her in that room and make sure that she understands that that's her room and that's her safe spot. So in researching her coverage, her insurance, you see that she has Medicare Part A and B. She also has an insurance card in her purse that you're going to have to investigate. And you do know that your father had retired and your mother does have some sort of income from his retirement. So you're going to have to find out from the rest of the family exactly what's going on with that, if they know. And if not, you're going to have to do some research. So you find out that she does have this income. She may not qualify for anything low income because she does have about $5,000 in the bank, which is good. She gets about $2,000 a month between Social Security. She gets about $24,000 a year. So she's going to get Part A for free in Medicare. She'll have to pay for her Part B premium, which we'll go through. And based on her income, she's not going to qualify for any Medi-Cal or any extra help because of that $5,000 in the bank. So looking into Medi-Cal, you know, if somebody's hospitalized, the social worker takes care of all that, and you learn. You learn about it. Oh, yes, and Medi-Cal is California. So those of you that are not in California, it's Medicaid. She does have Part A and Part B, which is great. But there's other places, if she was able to get Medicaid or any type of Medi-Cal, you could look at the sites, the Medicaid sites, and you can find all kinds of things that are helpful for people who do qualify. There is, by the way, another, I wanted to mention a program called Extra Help, and it's for low-income subsidy program, and it's available to help pay for prescription drugs. That is also in the references. So I just put that in at the last minute. It was pretty interesting that you could get that. There's other Medi-Cal programs and Medicaid programs, Medicare and Medi-Cal. If she has Medicare and was able to get Medi-Cal, you would have Medicare as the primary, and then Medi-Cal or Medicaid would be the secondary. And you can look that up, what the amounts are that cause you to qualify. But there's also this program called Aged and Disabled Federal Poverty Level Program. I was looking into that, and you have to be disabled, of course, and not eligible for SSI. So it's interesting. You can get, if you have less than $2,000 in assets, you can get help from there. There's so many different things. This 250% is if you are, let's say you're disabled, but you can still work. It's a California Working Disabled. And I know a lot of disabled people that still work. They can get a little bit of help If you have countable income less than 250% of the federal poverty level, which in 2020, by the way, equates to $2,658 a month for individuals. So you can get extra coverage for anywhere from $20 to $250 a month, but it really does help when you are disabled and still working. So original Medicare, we're going to go into Medicare here because it is mysterious. There's all kinds of different things, and I tried so hard to learn these because, you know, when you get my age, you got to know them. You got to learn this stuff. Medicare Part A, that is what covers hospital, inpatient, limited time in skilled nursing facility, limited home health services, and hospice care. Most people don't pay a premium for Part A if they or their spouse have worked for at least 10 years or 40 quarters in their life. It does have a significant deductible at times, so you have to watch out for that. Part B pays a portion of the home health costs. Everyone pays a premium for Part B, and that's based on your income level, regardless of any additional coverage, okay? And it may have a deductible. This is where you pay 20% of your medical bill. Medicare is going to pay 80% of what is covered by a Medicare and seen by a Medicare doctor. There are doctors who do not take Medicare. And it pays a portion of your lab work. One thing to be very careful of is if a person doesn't enroll when they're eligible, they could receive a late enrollment penalty that will last their lifetime. So exceptions include somebody who is actually, or their spouse is actually working on some other group insurance plan. So be sure and sign up for Medicare when you need to, or you will have that penalty forever. Important. Part C, this is sometimes called Medicare Advantage, and it includes every type of Medicare coverage in one health plan, and we've all seen that. You can buy these different ones. It's a policy or benefit plan designed to bundle everything together. It doesn't always include Part B, so you need to shop around and see exactly what you want to have covered. Part D, this is the optional prescription drug coverage. If you want this covered, you can get it through, like I said, Medicare Advantage. But you need to shop around and look. There's different programs out there in different areas and different states as well. So shopping around is a really good thing to do when you get to that point. And with your mother, you need to make sure what she has. So you have this list of immediate tasks that you need to complete right away. She needs a place that's safe for her. You need to change her address. You can't do anything about her insurance until you change her address. Got to find that PCP for her meds. I really suggest home health RN, PT, OT, social worker. They will help to determine her coverage for DME because you're going to need some durable medical equipment, and you're going to need to order that. You might have to hire a person to build a ramp. You may have a husband that could do that. And again, determine the role. When you have somebody come into your home, it's very important that everybody there be able to have a role in the care process. If you in this scenario, you have a husband, and your husband, you need to talk to him. What are you willing to do? What are you not willing to do? How much help can I get from this person? That's important because as a caregiver, you're going to need that support. And that brings me to the support group. Support group for a caregiver is so important, especially if they have dementia. So find an adult place that, an adult daycare if you can, and see what the cost of it is. That will really, really help. It will really, really help to let you take care of this person longer. So I want you to know that this, even though burden, the word burden is in this program, that refers to the healthcare system and getting everything covered for your loved one. I want you to really understand that this is not, the burden part is not the caring for the mother The burden part is getting everything organized. So, even though all the structural burdens of the healthcare system are difficult, it does take time away from taking care of your mother. So you need to really get some help with all of that. If she needs a safe place to sit in her room, you need to get this room done, box everything up. I'm just going to go through because I want you to understand how much time it takes to prepare, to connect with her, to help to make it so that she feels safe. Have her choose which comforter she wants. Let it be her choice. Let her know that this is her room, and let her do small things that she can do. If she wants to arrange it how she wants to, just let her do it. Because you need to give her some autonomy here. It really, really will help. So let's just go through what you're going to be going through. Okay, so 8 to 10, your mother's going to wake up. She needs help with her ADL. She can't stand up very well without help for long periods of time, but she can walk with a walker to her chair. But you notice that her bed is soiled. So you're going to strip her bed, put it in the washer, whatever you can do right then, and then you got to fix breakfast and get her medications done. So those things take time, and I want you to see that time is spent with your mother. So then as the morning goes on, you're going to need to take her, of course, with her incontinence. It's going to be difficult because you have to take her to the bathroom, assist her in there, assist her while she's in there, clean her up afterwards, and, try to keep that IAD from getting worse, and then walk her outside for some exercise, and then she's going to sit outside for a while. Now, you've already asked your husband to go to the store for you, so hopefully that was done. And she, she doesn't like anything that she doesn't get to pick out. So your husband had picked out some pads for her incontinence. She didn't like them, so she wasn't going to wear them. That you can kind of help to manipulate her in a kind way to let it be her idea, and then she'll wear them. So you got to work with that type of stuff to get her to do what you need for her to do for herself. So here we go in the afternoon, 12:30 to 5:30, to the bathroom. You got to feed her some lunch. Hopefully your husband helped with that. Back to the chair, bathroom with assist, sitting in the chair napping. Now, that's a good thing. That's a really good thing because while she's napping, you can get maybe some phone calls done. In the evening, bathroom with assist, sitting at the table eating dinner, bathroom with assist. This lady's got not only incontinence, she's got a lot of things going on with her bladder. And I won't go into details, although I'd love to because I love talking about bladders, but she has, a problem. So then you're going to get her ready for bed. You've got to give her medications. And I forgot to tell you, she's got glaucoma, so you've got to give her eye drops. To do her eye drops, you have to sit there and wait for her in her chair to let the eye drops get in there. Before you can assist her to bed, she's very, very slow. It takes forever. You get her in bed, kiss her on the cheek, and tell her good night. So that took a lot of time that you really don't have. Her nighttime needs, okay, that should say 10 till 8 a.m. on there. That's underneath needs. But you can see she's in the bathroom. She's back to bed. She's in the bathroom. She's back to bed. It's really, really a difficult thing when your bladder says you have to go and you really feel like you want to go. And even though she has dementia, she has feelings. So she's embarrassed. She doesn't want to leave. Goes on and on. But as you can see, it just keeps going. You're in there all the time. And you gave her a bell so that she could ring when she needs help because you don't want her to get up by herself. You don't want to deal with any falls. So let's talk about your daily tasks. Okay, you're going to be up at 6. You do your own ADL. You can put some laundry in if you can possibly get time to do that. You might water the yard or have your husband do that. And then, of course, from 8 to 10, you're assisting her with all of her things that we just went over. And it takes a lot of time. So this is the time that you could be on the phone dealing with all of her issues for money and insurance and her all of the things that she needs, especially a doctor. So 10 till noon, again, bathroom. She has urgency and frequency. She also has loose stool, so you're cleaning up stool every time. It may be on the floor, maybe in her little panties that you finally got her to wear, her disposable underwear. You're cleaning it up all the time. So this takes a lot of time. You're going to make sure that she's hydrated. You know, there's all these things that are important when you care for somebody, to give them all of the things that they need so that they, you know, are not neglected. It's a lot of work, a lot of work. So in your evening time, hopefully, if you have a husband like mine, I have a very dear husband that helps me with a lot of things, and he loves to cook. So that's wonderful. So hopefully he's already got the dinner done. You're going to sit down and eat with her, make sure she feels nice and homey and family-oriented. And then, of course, there's dishes, clean up, assist her to the bathroom over and over and over, assist with night care. You do her medications, her eye drops, and you get her in bed. And hopefully you can get a couple hours sleep before she gets you up. But from 8 to 11, you're going to finish the laundry. You're going to read your mail, pay your bills, do all the things that you would normally do. And if your husband didn't go shopping, you're going to end up doing that at night. But your self-care is very, very important. 11 to 8, again, bathroom with assist 3 times for that ringing bell that you're now hating that you gave her. However, it's really good to keep her from falling down. And with the stooling, you want to be in there because it's really, really hard for her to try to clean it up. In between all of those things, you've got your phone calls, coordinating healthcare, finding help, finding support group, hiring a carpenter, cleaning the house, taking mother to appointments, groceries, cooking, all of these things. But you first, oh dear, you need to make sure her address is changed because you need to be getting her mail. You need to find out what's going on with that. So all of these things are necessary. It's not that they're not. So her first visit to the primary care physician went really, really well. We got all kinds of referrals here. You got a name of a dentist that she's going to need because I forgot to tell you she's got some very bad teeth and dentures, partials. And you need to find one that takes Medicare. That's important because some don't. Primary care physician also put in an order for your home health RN, PT, and OT. Great. You're going to need an ophthalmologist, an orthopedist. You're going to need an otolaryngologist because she is having trouble with her ears. Not only do her hearing aids not work, so you need a hearing aid person too, but you need an audiologist to do some testing. And I didn't mention too, you need a dermatologist also for her skin cancer history and her psoriasis. And then, oh my gosh, get a podiatrist because she's not going to let you do her toenails, and her toenails are really bad. So these are just a lot of things. Oh, and it might be good to get a GI involved for that horrible stooling situation. Also a urologist for her issues with her bladder. She has peripheral neuropathy as well, so she needs to see for her neuropathy, she really needs to see a neurologist. And you're juggling all this. You're juggling everything as you're doing this. So you've identified these needs. It's wonderful. They've helped you. You can see your beautiful ramp there. You've got a raised toilet seat. You need the new walker. You need a low air loss mattress because I told you, I didn't tell you, she has a stage 2 on her ischium. So you do need to have a Roho cushion for her chair. Home health will give you a medications organizer, which is great. You need the grab bars put up, the bed rail, everything has to be done. And you're getting there. You're doing really good here. So for your self-care, the number one thing besides getting help, you really need the help. The number one thing is you need to research and learn about dementia because if you don't, you're going to have a lot of problems with your mother. It is important that you understand how to connect with them and how to help them through this. So you did some research last night and you understand that dementia is an overall term. It's describing symptoms that impact memory, and performance of daily activities and communication abilities as well. Alzheimer's is the most common type of dementia, and it does get worse. It doesn't get better. It doesn't go away. It affects the memory. It affects the language and all the thought processes. It's not a diagnosis. It's a set of symptoms that, you know, are due to the loss of normal brain function. So out of the 70 different types of dementia, 80% are caused by Alzheimer's. So it's a huge problem for people. And what happens with Alzheimer's is the neurons are injured and they die and throughout the brain, and it atrophies, the brain volume gets smaller, and different regions just begin to shrink. So there's this lady that I had talked to that is just wonderful, and she has a book out that is a great book to read if you have anybody in your life with dementia. But her name is Laura Wayman, and if you look her up on YouTube, you can look at her videos. It's very, very inspiring. It's wonderful. And so she teaches people, caregivers, how to deal with people with dementia. And one of the things that she says, and I know it sounds kind of funny, but if you're talking to a lay person about it, you want to explain to them in a way they can understand. So she says that there's a little rat called Mr. Alzheimer's, and he gets into this brain, which is a big cheese ball, and he eats little holes in it that never come back. And when you think of it that way, now we have this Swiss cheese-looking brain, and the neurons aren't working. So when you say something to that person, it randomly will hit in different areas. This is how she explains it. And if it hits in a blank spot, they're going to just sit there and look at you and not answer you and not know what you're even talking about. So it's very important to understand that, because it can be so irritating to say something, ask something, and have them just look at you like you're stupid. You really need to know that they're not doing that on purpose. I could go into a lot more detail with that, but look at her YouTube videos. It is wonderful, and her book as well. So these changes, all these changes affect people in different ways. The symptoms are not always the same, and they're not always obvious. One of the things that I found interesting is that if you are with somebody in a restaurant, let's say, and they're looking at this is the first place some people realize that somebody has some dementia going on. You're sitting there looking at the menus, and they look at you and say, you know what, you order for me, because I don't care. You order for me. It's overwhelming, especially some of those places where the elderly people do go that have a menu that's 5 pages deep. You know, they get very, very overwhelmed. I just want to say that if you study this, if you know anybody that has any type of dementia, it's just incredible. Laura Wayman, she's the Alzheimer's whisperer. She says that a person with dementia definitely needs people to understand what's going on. If you don't understand, you're in trouble. So, you know, they might even do things such as put the bread in the washing machine, or put money in the oven. Things like that you'll notice when they first start coming into being, or withdrawn. They can very much withdraw into themselves because they're frustrated or angry because they can't tell, you know, what's going on. They may ask questions over and over. They may tell you the same story over and over and over. They may make phone calls to the same person over and over and over. They can't do their household chores. You know, there's just all these things with dementia that makes it so that they need your love and they need your understanding. Close relatives of a person, you know, they may be worried that they might get this as they're growing older. And, you know, funny thing is that close relatives of a person with dementia are more, they're more than likely, they think that they're worried about that they're going to get it. But the fact is, many people with family history of dementia don't get it. So hopefully it's not something that is going to be carried on. Also, medical history. People who have had a stroke or have high blood pressure, it heightens the risk of vascular dementia as well. Life choices, excessive drinking of alcohol, lack of exercise, all of those things, smoking, poor diet, those things can also contribute to getting dementia. So what can we do? Obviously, we're going to try to do all of these things. Serve them healthy, balanced diet, get them to stop smoking, help them reduce alcohol consumption, and of course, encourage them to exercise regularly if you can get them to do that. And there's lots of tricks to try to get them to do that. The aggressive behavior, that can be very difficult. So one of the things that I learned is you try to see things from their point of view, okay? So we understand that we can meet the person's needs and prevent the situation from happening if we work in their world instead of our own. So for instance, if mother says, if she gets angry when you say, "Mother, it's time to get ready for bed," she'll say, "No, don't tell me what to do." And you might say instead, "Do you need to go to the bathroom?" And if she says, yes, I'm going to go to the bathroom now. And after the bathroom trip, she might say, "It's time to get in my pajamas," because she knows that routine. So really try to work in her world, because aggressiveness is a sign of confusion. And they really hate questions because they can't think of the answer right away, so they get really upset. So look for the person behind the dementia, get their history. What went on before? If you have somebody who's been a superintendent or a boss of many people in their working life, they may tend to be bossy. So you would be able to get them to do things that you want them to do by letting it be their idea. And I do call it creative manipulation, but that sounds negative. It's not really a manipulation. It's more of creativity. One of the things that I learned from Laura is that they're not going to learn anything from you. At this point, they're not going to learn anything new. You have to accept it as it is. You can't stop it. You can't fix it. You can't change it. You must accept it. And she says to try where they're living and don't try to pull them into your reality, because it will not work. It will not work. It's better to respond to their feelings, because their feelings don't change, but their thought processes do. People can feel powerless when they have dementia. And sometimes it's portrayed as taking away their identity. They're there, but they can't express it. So although it is a loss of some abilities, their feelings remain intact. So empathy and support helps to maintain their identity as well as their comfort in their life. So that's huge. They do feel sad and powerless because they really don't understand what's going on. So do things that they like. You know, older people will learn or will remember from way back all of those songs. So get them singing. It's great. Promote independence whenever possible. Find out what they like to do. I have to tell you that one time I had a patient I went to see who was on hospice, and she told me when I got there, she said, "My baby went away." I didn't know what she was talking about, but the next time I came, and she wouldn't let me even turn her over. So next time I came, I bought her a little doll, a little soft doll, and I handed it to her. I said, "Here's your baby." Oh my goodness, she loved that doll, and she clung to that doll, and I got to do my debridement. So that really helped her, and it made her happy. The other thing, too, that we do with people at night, a long time ago, if you had a confused person at night, I'd take them in a whole bunch of washcloths at the hospital. Take some washcloths. "Would you mind folding these for me?" That's something they know to do. I had a little lady sit there and fold them, and then she's done. She called me, "I'm done." Took them out, went out in the hallway, messed them up, brought them back in. "Oh, I found some more I need you to do." That is creative stuff that really helps them feel like they are helpful, like they mean something, like they still have a life. I just want to say here that we try to keep them with their culture and their religion. Family members would like us to do that when you take care of somebody. Reminiscing, I've got to go fast here, but reminiscing usually works for old people because they remember the dementia allows them to remember far back. So get them talking about the past. They love to talk about the past. So it's very mood lifting for them to reminisce. You can get them to write their life story, help them put a book together so that later on they can go through it and remember these things again. This is what keeps them happy. There's other factors that can change their behavior if they can't hear well. Believe me, it is really hard when they say what 15 times. It's difficult, but you have to understand they can't hear or they can't see. Arthritic pain, oral problems, check these things out because these things can cause them to have a little bit more confusion. Again, PCP, we already talked about that. You got all your help. So what I really want to get through is that, you know, the National Family Caregivers Association says that people with dementia are 3 times more work, more stress than caring for anybody else with any other type of illness, because it is a very mental thing as well. It's a long journey, and really getting help is the best thing to do. And there's a loving approach to taking care of these people instead of trying to argue with them because it does not work. Believe me. This can truly, with this mother coming home to you, it can truly be a blessing in disguise for you and your mother. You may be able to rekindle a loving relationship. She'll most likely remember all the things from the past so you can go over what it was like when you were little. There's all kinds of things that you can do to bring those out and let her feel like she really has a meaningful life, and they love that. You know, one of the things, my father has dementia, and one of the things that he says very often is when we were little, he used to go fishing, and one time he came back and put a fish in the bathtub with my sister and I, and we had a fish in the bathtub. He mentions that at least once a week. That's something that he remembers. And one thing he remembers about it is he says, but I had to be the bad guy and kill the fish for dinner. And I try to reassure him that we were okay with that. We knew. But remember that your reality is not their reality. You cannot bring them into yours. Your peace of mind will be saved once you understand that you didn't cause it, you can't stop it, you can't fix it, you can't change it. So acceptance is the key. That's all you can do. And I want to read this poem to you because, and I know you can see it here, but I could tell you that if I didn't see that it said unknown at the bottom, I would think my father wrote it. But it says, do not ask me to remember. Don't try to make me understand. Let me rest and know you're with me. Kiss my cheek and hold my hand. I'm confused beyond your concept. I am sad, sick, and lost. All I know is that I need you to be with me at all costs. Don't lose your patience with me. Don't scold me or curse or cry. I can't help the way I'm acting. Can't be different, though I try. I just remember that I need you. And the best in me is gone. Please don't fail to stand beside me. Love me till my life is done. And I want to say here that there's a song by Glenn Campbell that is, I Won't Remember You. If you know anybody with Alzheimer's or any dementia, listen to that song that he wrote when he was at the end of his life with Alzheimer's. It is absolutely beautiful, and it tells the whole story. So with that, I'll let you have it, Brooke. Thank you, everybody.
Great. Thank you so much, Kelly. That was a wonderful presentation. Just very quickly, as a reminder for those who registered as healthcare professionals, nursing CE credit certificates will be emailed to attendees no later than within the next 2 to 3 weeks. If you do not receive your CE certificate, please check your spam folder and reach out to us at marketing@shieldhealthcare.com so we can assist you. And please, next slide, please. Thank you. If you enjoyed today's webinar, you can find more educational information on Shield Healthcare's online community site. Our community site has over 2,200 educational articles, videos, and lifestyle resources that are provided by some lifestyle specialists, Erin Baker and Laura Cox, parents of children with special needs, and much more. We update our community site several times a week, and we encourage you to explore those resources at shieldhealthcare.com/community. Next slide, please. Great. We also have several free educational booklets that are available to anyone at no cost, including Living Well with Incontinence, Living Well with an Ostomy, Aging Safely at Home, Tube Feeding Guides, Wound Management Guides, and more. You can find the links to request those guides on shieldhealthcare.com/community. And next slide, please. All right, and if you have any questions or you need to reach out to us and for more information, please email us at marketing@shieldhealthcare.com or reach out to Capital Nursing Education at capitalnursingeducation@gmail.com. At this point in time, we're going to open up for questions. We have had some questions rolling in, so I'm just going to jump right in. Kelly, what do you do when both mom and dad are both resistant to help and you can see that they need it? They're not hospitalized yet. Where do you go for assistance?
The first thing I would do, it depends. If they have dementia, do they have dementia? Did she say that?
It's not mentioned in here, no.
Okay. So if they need help and they're not, first thing I would do is call their primary care physician. And even though they may not talk to you, you can talk to them. Send them a letter. Hey, my parents are having problems with this. But if it is serious, if that parent is not taking, if the parents are not taking care of themselves in the way of cleanliness, food, taking their medication, going to the doctor regularly for checkups, if they're not doing all of that, I would call APS, because APS, that is self-neglect. And they won't, it's not like you're going to get them arrested, no. They will make sure that there's people that come in that can help them. You can get home health set up for them to check on them all the time. But the main thing is, if they're unsafe, you really need to report it so that things can be done. They might send somebody there to check on them, do a welfare check, and go, no, they can't be in this house like this, and they're going to do something about it. They might need placement, or they might need to, really get involved with what's going on. I've seen APS go out over and over and over and slowly help them, patients get their act together with what they need. And if somebody is totally with it, that person has the right to refuse. However, they don't have the right to abuse themselves. So that's what I would do.
Great, thank you. And I'm going to jump to a question that just came in and then back to some others. Can you explain what APS is, please?
Oh, I'm sorry. That's the Adult Protective Agency. Adult Protective Agency, Adult Protective Services is, that's what it is. Adult Protective Services is everywhere. It is it's an organization that is part of the law. I mean, it's just like Child Protective Services. If somebody's abusing a child, you're going to call CPS on them and make it so that the Child Protective Services check on that child. Well, it's the same thing with Adult Protective Services. It's just for adults.
Great, thank you. Hang on one second, let's see. How do you deal with a loved one who doesn't want to do anything?
That's so hard, and it depends on why. I would do an assessment. Is it pain? Is it just stubbornness? Depression. It could be depression too. I would, if I had a parent like that or a person like that, the first thing I'd do is get them checked out by a physician. Find out, is there pain? And you got to watch them, because sometimes they'll hide the pain. Don't want you to know they hurt, because guess what? They've been strong forever. And they're not going to answer you when you say, do you have pain? You have to really observe them and see, and you can see if that happens. But the main thing is to get them checked out, and if the physician looks at them and decides that, yeah, we need to do some x-rays, maybe there's some back issues, maybe they need to have an antidepressant, maybe they need to be able to learn to converse. They were not going to learn it, but maybe they need to see somebody, a psychologist, or find out what the problem is, why they will not accept help. There's always a reason, and you have to get into, especially if there's dementia, get into their life and try not to pull them into yours. You got to get into theirs and try to, I mean, there's some examples that I can think of is like if a person has, let's say you had somebody who was a police officer, let's say, and this is somebody who's refusing care and who is being obstinate and who is the tough guy that doesn't want to do anything, or the soft guy that did so much to help other people. But either way, you want to get into their world, and you know, and maybe say to them, if you had somebody that you went to see and they hurt, what would you do? You know, and get them to be thinking about it too. I could go on. I better stop. Go ahead.
Great, thank you. Just a quick one. Could you please tell us again what the name of the book and author is, the book about dementia you mentioned earlier?
It is Laura Wayman, W-A-Y-M-A-N. And the book that I have is Learning to Love, Caring with, I forget what it's called. See, I have dementia, right? No, I can't remember what it's called, but look up Laura Wayman. She is well known. She speaks everywhere. She's wonderful. And like I said, on YouTube, but if you even go to Amazon and look up Laura Wayman, you're going to see all of her books and all of her work. She's just incredible. I actually met her on a support group telephone call, the first one I ever did for us. And she just happened to be the person who was moderating that. And it was wonderful. She helped me more in that 1 10-minute talk with her than I could not believe how much she helped. She was just absolutely wonderful. I wrote down her book, but I can't find it right now. Look up her name, whoever that is that asked that question. It'll pop up.
Great, thank you. Where can we get information for caregivers that are experiencing burnout? Do you have any recommendations?
Oh my gosh, yes. In that one slide, there's 3 different organizations. But if you just go onto your own, go on there onto the internet and say elder care, and there's going to pop up a whole bunch of stuff. You look into the references of this program, you will see I've referenced them in there. You can find them, and they are wonderful. The Alzheimer's Association, though, let me tell you, there's a lot of references there, a lot of places you can get help. But elder care, eldercare.com, I believe it is, if you put in your own zip code, like I said, it'll pop up all kinds of help for you. And if you have trouble with that, there's also places like Keeping Mother at Home or A Home for Mom, or, you know, all those different organizations all have support available. Some of them charge for their services, but if you go online and look under elder care, you will find places in your own zip code that will be able to help you.
Great, thank you. And we're running out of time. We've got a lot of questions here, so we'll try to squeeze in just a couple more. We did have someone comment that the book name we believe you might be looking for is A Loving Approach to Dementia Care.
Thank you. Thank you. A Loving Approach to Dementia. That is the book that's on my desk. It is wonderful. And I can't say enough about Laura Wayman. I was so impressed with her help. And she says it in terms that, like, you know what? I don't want to be the nurse. I don't want to take care of my father without being the nurse. I don't want somebody to say to me, well, you're a nurse, you know that. No, I'm the daughter. I'm not the nurse. In this situation, I'm the daughter. And that's how she treated me, and she talked to me in layman's terms, and it was wonderful to be the person who was getting cared for. I was actually feeling like she cared for me. And I haven't been in that position very much. I've always been the caregiver. So I just have to say kudos to her. She's a wonderful person, and she's just got so much information. And those people that are on the support group, swear by her. They are all, when I heard them talk, I was in tears. She has done so much to help them. So, yes, I love her.
Great, thank you. Okay, well, we're going to try to
squeeze in my house.
We're going to try to squeeze in just two more questions for now. If we don't get to your question, we'll do our best to reach out to you and get those questions answered. We know you have a busy day ahead of you. Can you please share, is a lack of appetite normal for Alzheimer's? Normal in quotes.
You know, yes and no. One of the things you can do about, yes, they do become less and less interested in eating. One of the things to do is make their food presentable. Like, for instance, good example, my dad doesn't want his food touching. I had to learn that by watching him. So on his plate, we need to make sure that everything is separate, and he eats one thing before he goes to the other, before he goes to the other. Never ask for seconds, so I put plenty on there and tell him you don't have to eat it all. But there's ways of watching them, and if they're picky eaters, you can talk about history of food, you know, what did you like when you were little, you know, and go into their world. And sometimes you can get that out of them, what they really want to eat. The other thing, it has to be pretty. It has to be a little bit, because they've lost their taste buds. I hate to say this because I don't promote salt, but I'm telling you, if it's bland, elderly people will not eat it. So you got to put some herbs or something in there so that it has some flavor, because they lose their taste buds, and the last one to go is sweet. So you don't want to give them sugar. You got to back off on the sugar and carbs a little bit, because you don't want them to, you know, especially this mom in this scenario is type 2. So just make it presentable and try to dig out of them in a very creative way what they like to eat. Show them pictures of food. That's another good one that I've heard in the hospital. Take pictures, a magazine with food in it. What looks good to you? You know, do you think we should have this for dinner tonight? You know, something like that, to where you get an idea of what they want. But yeah, they will eat less because they're not interested. Just not interested.
Okay, great, thank you. And the last question for today, this is a great question. I actually have some personal experience with this with an aging relative. My mom refuses to give up some of her driving. The doctor told her no freeways and no night driving. She still plans to drive for their timeshare. What would you do to help her gracefully give up these freedoms?
That is such a hard one, because I had to do that with my father, and it was very difficult. One of the things that I did is I rode with him. It was the scariest time of my life. And I rode with him, and I pointed out things like, oh, I'm glad we didn't have to stop real fast, because my dad can't stop real fast. But I sat down with him, and we talked about his reflexes. You know, I played a game with him. Dad, hit my hand. See how fast you can hit it before I move it. And I proved to him that his reflexes, I mean, I hate to do that to make him feel bad, but it's not safe. If you can't move that foot over fast, it's not safe. I have to say, I'm not happy with, I would be very not happy with a doctor who limits the driving. You either drive or you don't, to me. But telling somebody, well, you can't drive at night, it's kind of like, well, if I can drive at day, why can't I, you know, it gives too much options there. I would say, I will take you anywhere, and this is what I did. I'll take you anywhere you need to go. I really would like to drive, because I really don't want your head up against that windshield. And for my dad, I had to be strong about it. And I literally bought his car from him that I didn't even need, so that I could, yeah, no, I will take you anywhere. And I do. If he wants to go, you know, wherever he wants to go, I take him. We go for rides all the time. It is a hard one, I agree. And it depends on her mentality, and it depends on her history. If she's had any accidents, my dad was a very good driver, and the only thing I know of is he ran into my garage one time because his neuropathy made it so he couldn't hit the brake. He couldn't feel his feet. So I pointed that out to him too. It's a hard thing to do.
Great, thank you so much. Kelly, thank you so much for a wonderful presentation, and thank you to everyone who joined us today. We appreciate that you shared an hour of your time with us. Have a wonderful rest of your Wednesday.
Thank you so much, Brooke.